Hi everyone, I'm Paige Abbott and this is your weekly recovery message. Hopefully at this point in your recovery, you're all familiar with the idea of a stash. This is the idea that the disease will have certain things that it keeps secret or even literally hangs onto, so objects, substances, people, that it can draw on when it's looking for a hit or when it's looking to bring up pain or discomfort to propel you to want to seek relief. And that's the idea that I wanted to talk about today more directly, is this idea that we could call a pain stash. So not a literal stash of a person or a substance that the disease is hanging on to, but more of an emotional or a subconscious, unconscious stash that the disease will bring up periodically to feed itself. And what I mean by that is that the disease will bring up these memories of this pain, and this can be physical pain as well as emotional pain, and all of a sudden the brain will just generate this memory and this experience, and it will be very uncomfortable. And even in that discomfort, there's a bit of a hit, because we do get a dopamine release when we're experiencing pain and discomfort, even if there's nothing happening externally. So right off the bat, when this memory comes up, the brain is getting a hit off of that pain. Now, the pain, of course, can be quite uncomfortable, especially if people are unsure what to do with it, if they're having a hard time sitting and coping with these feelings. So then the additional attachment is that the disease will propel you to want to seek relief, which of course then is another way that addiction feeds itself, is through that relief or escape seeking. So then people may go out and find a behavior or a substance that seems to provide relief from that pain. Of course, this is a fallacy. Just covering up that pain, once again, doesn't do anything to heal from it or deal with it. It just pushes it back down, and it keeps that stash there so that down the road, the disease can bring it back up again. What do we do with this stash? We can't disconnect from it or throw it away as we can a substance stash, or end a relationship as we can with a person stash. But with a pain stash, what we need to do is be aware that it exists, and also look at drawing internal boundaries with yourself. What that means is that when these thoughts and memories start to percolate up, that it's important to recognize it is addiction trying to take you for a ride. It's trying to generate pain and discomfort and trying to propel that escape and relief seeking, so that you can then recognize that and draw that boundary of saying, okay, I recognize what's happening. I can't stop this memory from coming, but I do need to reground myself in reality. So I need to focus on what's actually happening in my life in the here and the now, engage in self-care, engage in recovery action, and be mindful and present. So all of these techniques and strategies do help you to then draw that boundary with the pain stash, which again, you can't eliminate, but you do need to look at disengaging from it. Ultimately, processing the feelings that we're carrying regarding this pain, physical pain or emotional pain from the past, helps to also take away the momentum and the power of that stash. So now we're healing from some of those feelings so that they're less powerful and less potent. So even down the road, when addiction tries to bring up these thoughts and memories and generate pain, there will be less attachment and association of pain to those memories. Hopefully in the next little while you can continue to explore what pain your addiction is hanging on to and bringing up to use and fuel itself. And as you gain awareness, then you can look at drawing boundaries and engaging in self-care and emotional healing. Thanks for watching. That's my perspective for this week. I wish you the best in your ongoing journey of recovery. Bye for now.